Welcome back to Health Simplified, brought to you by Centera Health Plans, where we improve health every day. I'm your host, Zanola Smith. No matter who you are or where you are on your health journey, this podcast is designed with you in mind. We're giving you simple answers to big questions surrounding health, no big words, no fluff, just facts. May is Mental Health Awareness Month, and today we're talking about postpartum depression. While bringing a baby into the world is often seen as a joyful experience, for many parents, it can also come with unexpected emotional and mental health challenges. To help us break it down, I'm joined by Kate Moss, who has spent nearly 15 years working in maternal health, supporting families through education and care. Let's get started. Well, Kate, thank you so much for joining us today. We are so happy to have you here. Before we get into the nitty-gritty of today's podcast, can you please tell us a little bit about yourself and what made you become passionate about this topic?
Yes. Well, thank you so much for having me. I'm excited to be here. I love women's health, specifically maternal child health. That's where my heart lies. So I studied public health and psychology, and that's what really kind of led me to my career path. And I was specifically interested in preconception health and family planning. So that, what do you do to be healthy before you even get pregnant? And how do you learn about your body and your risk factors for any conditions you may develop. So I did a lot of my work through my education in that. And then once I started getting into my career, I really honed in on family planning and the importance of, using your resources and access to care to really plan your family and work toward having a healthy experience for when you do decide to, get pregnant and have a baby and have a family. So that's where a lot of my work stems from. Yeah. And with public health, I just became really passionate about, learning that evidence-based, doing the evidence-based research and learning about best practices for women and how they can, take care of themselves and, practice good care to have healthy pregnancies and deliveries in that family unit. So that's where a lot of my work is stemmed from. And I just love all things public health. And I really, became passionate about learning about the disparities people face when they're navigating the health system. And yeah, so that's kind of how I got into it. And then I really kind of grew into it when I was planning and having my own family. So that really strengthened my need for wanting more information and learning about the field more. And, I was experiencing it at the same time. So
definitely going through something can bring your awareness to very high end. So that's really good that you had the passion for it. And then you went through it yourself so that you can help people, discover who they are. And also something else that you said that I really liked is family planning. I think in today's society, family planning is super huge. So the fact that you're there, at the beginning of the journey, middle, end is super helpful. And I'm sure people will find that helpful as well. So thank you so much for sharing about that. And I know that we have a lot to cover today. So before going into it, before we start talking about the facts and the statistics and everything like that, is there something called PMADS? Can you kind of explain what that is, and is it the same as postpartum depression or what that is?
So PMADS are perinatal mood and anxiety disorders. So there can be several. So you can experience postpartum depression, bipolar, OCD, post-traumatic stress disorder, anxiety, generalized anxiety. And so those are PMADs. And so PMADs can sound kind of scary, but postpartum depression is a mood disorder. So it's, kind of encompassed in a PMAD. And there's just a spectrum and a range in which you can experience a PMAD.
Yeah.
So, for example, like when we talk about postpartum depression, you could have a very mild case of it, or you could have very extreme. And so it's just a matter of what are you feeling, all the things you're experiencing. And then PMADs are a medical condition, so you do need to seek treatment. And PMADs can last up to a year after you've had the baby or longer.
If I'm someone that is just listening in for the first time, I've never been through pregnancy, or I'm a spouse or anything like that, and I'm just saying, what is postpartum depression? How did you get here? Things of that nature. So can you kind of tell us what postpartum depression is?
Yes. So postpartum depression is a mood disorder that you experience after you have your baby. So the onset is typically within 4 weeks of having your baby. And it is categorized by, these intense feelings of sadness, hopelessness. You may feel, worthless, and you have kind of a loss of interest in kind of taking care of yourself and even your child. You may have difficulty bonding with your baby. You feel isolated, very overwhelmed, not sleeping, of course, which is kind of another topic on its own, because you don't sleep much when you have
A new baby.
or other children in the home. Loss of appetite, just a very low mood. And so it shockingly affects 1 in 8 women. And that's according to the Centers for Disease Control and Prevention, the CDC, and the Office of Women's Health. And shockingly, outside of that, on a community level, there's different communities where it's even 1 in 5 people. So postpartum depression, there's a range and a spectrum in which you can experience it. So you can have a very mild case, or you could have a very severe case. And regardless, it's about recognizing the signs and symptoms, educating your family, and being educated on the signs and symptoms, and asking for help. So, so postpartum depression lasts longer, it lingers, and you really feel like something is wrong.
Okay.
You need to seek help.
It's something that you don't want to go through by yourself. And it sounds like it can range, obviously, like you said, for moods and just how you're feeling. And sometimes people may think that is normal, but it's actually not. So seeking that help is what I'm hearing you say. Yes. So with that being said, what are some of the risk factors? Are there any risk factors where someone would be, I don't know if the word is riskier, what are the risk factors for, who's more at risk? Thank you.
I think it's important to say that postpartum depression can affect anyone. So regardless of your background, what you look like, your support system, it can affect anyone. Mm-hmm. Now, with that said, you are more at risk for postpartum depression if you have previously experienced depression prior to being pregnant, if you have a family history of depression in your family, if you don't have the support in the home, if you are of lower socioeconomic status. So, if you are experiencing anxiety or have had anxiety prior to becoming pregnant. So there's lots of different risk factors that can play a role. Women of color, Hispanic population have higher rates of postpartum depression and of not seeking care for that depression. So there's lots of risk factors that I think is really important for health professionals and communities to look at within their own populations at how we can screen these women for postpartum depression prior to them becoming pregnant and after, to really tackle the barriers that women face during this time and to help them get support and access those mental health services and how important those services are.
Because they're out there. The services are out there. It's just about accessing them. And I think something that you just touched on that made it very clear is just to get help and also know the risk factors, because if you don't know the risk factors, you may think, oh, I'm just feeling this way just because it's cloudy outside. Like, I don't know why I'm feeling this way, but it's lingering on. So with that being said, what are some of the causes? Is it just, oh, I've had a baby and now I'm just sad when this should be the happiest time of my life? Or are there any type of hormonal imbalances? And I ask that because as women, we know that our hormones can range crazily. So
research shows that, your rapid drop in your hormones, so your progesterone levels and your estrogen levels after childbirth, can cause postpartum depression. Obviously, your environment. So, where you live, who you live with, if you've experienced previous trauma, if you, again, are having challenges navigating the health system. There's lots of different causes that could impact postpartum depression. And when we talk about it, it's really interesting because we talk about it experiencing trauma. Well, having a baby is a traumatic,
very much so.
So it can be a very beautiful, positive experience. No one's taking that away from it, but it's also a trauma. It's a trauma to your body. It's a shock to the system, your nervous system. You're not getting any sleep. It impacts your whole well-being. So it is a trauma, and I think that it's really important to acknowledge that. And when we acknowledge that, then we kind of learn how to tackle those feelings and who to talk to and who to go to for support. I want to mention too that with postpartum depression, you can experience it prior to during your pregnancy. Most of what we hear about it is
after the fact.
After the fact.
That's good that you brought that up, because I don't think people realize that you can experience during your pregnancy, which I think now that I'm thinking about it, it sounds factual because your body is changing. You have those hormone increases, decreases. So I can only imagine you experience it through it and then after, but it's just not talked about.
Right.
And now we're talking about it.
Yes. And I think that's why it's so important. Prenatal care is so important. So you need that prenatal care because you're going to need to talk about how you're feeling. You're getting your checkups. You may be screened to see if you can talk about those risk factors that you're experiencing in your own life, in your own body, that maybe can help prevent you to have a more positive and better outcomes after delivery. So that prenatal care is just so, so important for women to get during their pregnancy. And then, of course, that postpartum care. So you can get postpartum care all the way through the first year of having your baby. And some women are not even getting that. So it's so important to go to the doctors, talk to your providers, get that support, and make sure that you have, a good path for recovery after you've had your baby and a support system in place.
That makes a lot of sense. I think for me, what I'm taking away from this is have a game plan, get with your provider and stick with that game plan so that you can have a successful outcome. And even if you are feeling those, signs of depression early on or in the middle or the end, there's a plan for it. We just have to use our resources no matter, where we are in life. And it can happen to anybody.
It can impact anyone. And I think a lot of my work stems in communities that really need the support, need the resources, need the access to care. And so not everybody has the same support systems at home. Not everybody has that, whether it's a spouse or partner or caregiver support. So in those cases, really providing that education and opening those doors for people who don't have that to access care and that they are being supported and heard. And when we kind of advocate for this, it's connecting with people and providing support, telling them how they can get the care that they need, how beneficial going to those postpartum appointments are, and who to seek, for help if you don't feel like you have that support at home.
That's good that you mentioned it's not a one size fit all. So what works for me might not work for you, and what works for you might not,
Right.
So just a very tailored plan. So that is super helpful, and I'm pretty sure it's helpful to our viewers as well. So thank you for covering that, what it is and everything like that. I know we've been talking about what postpartum depression is, but are there any risk factors that someone should be aware of?
Yes. So if you have had depression in a previous pregnancy or prior to becoming pregnant, you're at risk for postpartum depression. If you have experienced adversity as a child or trauma, if you've had an extremely traumatic birth experience for your current pregnancy, and if you've had little or no support in the home once you bring the baby home from your family or spouse or partner. If you are young, your age can play a role. Not always, but it can impact. So if you are under the age of 20, if you're having a hard time breastfeeding, if you have a baby that was born prematurely, if your baby has special health care needs. So there's a range of
Risk factors.
that you can experience, that may play a role in postpartum depression.
What about race and your background, or even where you're from, things of that nature? Can that play a role?
Absolutely. So we know that postpartum depression, the prevalence of postpartum depression is higher in our communities of color, so our women of color, our Hispanic communities, our Black communities, and that definitely is a risk factor because some of it is tied to whether you actually seek care for what you're feeling, cultural experiences, or it can be related to where you live, your home environment, and your financial status. All of those things play a role and can be a risk factor.
That makes a lot of sense, because it's like, if you think about those situations, finances, home life, those are stressful situations that someone can be in. And then you add a new baby to it.
Yeah.
I can only imagine what can take place there.
Right.
And also, while we're talking about what can take place there and why postpartum depression happens, are there other causes, or what causes it? Is it because someone is their hormones are fluctuating, things of that nature?
Yes. So there's a possible cause of your rapid drop in your hormones, so your progesterone levels, your estrogen levels after childbirth. It's such a shock to your system. You've experienced this traumatic event, which is childbirth. So yeah, that can be a cause. Lack of sleep, of course.
Yeah.
Stress, just already feeling stressed and overwhelmed. And then, of course, genetic predispositions. If you've had previous anxiety or a mood disorder prior to being pregnant or during pregnancy, all of those things
Can play
possible.
causes. And it also, I know that we're talking about the risk factor and causes. Would you say, even though that these are things that we know can affect someone to have postpartum depression, that postpartum depression there's not really a face to it? It can affect anyone, even if you don't necessarily fit in this box
Right.
that we're covering right now.
Right. There's no one size fits all with postpartum depression. It can affect anyone. But when we look at postpartum depression in the research, we see where the disparities lie,
Right.
and that women of color experience postpartum depression at almost double, their white counterparts. So similar with Hispanics, it's up in the 40% or higher
Right.
that they experience this. Those are risk factors.
Yeah. Those are the factual risk factors, like the research shows.
Research shows.
And we also are aware that it can affect anyone, but we are also cautious of the risk factors that take place. So that's really important to let everyone know, and I'm glad that you touched on that. And also, I've been hearing a lot of people say that it's hard to go from 0 to 1 kids, but it's easier to go from like 1 to 2 kids. Is there any type of correlation there?
It can. So it really depends on the person and what they're experiencing. But again, it's really related to, are there any other risk factors present? Your heightened anxiety, you're stressed, you may be overwhelmed, you're not sleeping. Again, you may have that depression prior, but maybe not. With 2 children, so you have, additional stressors in the home.
Yeah.
So that can definitely be a risk factor. And some of the research too shows that women who are of advanced maternal age can experience more incidences of postpartum depression than younger women. So there's really such a range, and it's hard to pinpoint exactly.
What's harder, what's easier.
Right.
Yeah.
And what one person experiences is not going to be the same for someone else. And I
Right.
think when we look at motherhood and, maternity and families,
It's complex.
it's complex and you can't compare. And so it's just taking what you do know and gaining that knowledge and again, getting the care that you
Need. I love what you just closed that question out with, taking what we do know, gaining knowledge, and then getting care that we need, which is, you can't put a better bow on that, because we're learning about these things so that we can help ourselves, whether we're at risk or not at risk. And that's not saying everyone will have postpartum depression, but we have to talk about it just in case someone does that's listening to this. They know that those feelings are totally normal and there's a way to work through it. So I am not a parent just yet, but as someone who is an aunt and a friend, sister, for someone who is not going through the birthing process, what are some signs that we can look for just so that someone can recognize that in their spouse, in their family member or friend?
You could look for mood changes, the individual isolating themselves, not eating, not sleeping, not bonding with the baby, feeling anxious and overwhelmed, heightened stress and anxieties. You're seeing excessive crying and sadness, the withdrawn behaviors. Maybe they don't want to see you or talk to you or have you around.
Yeah.
These are kind of some red flags.
Or text back. So that, I know they're probably busy with baby, but that definitely opens up my eyes a lot, because we know our friends, we know our family members, and I think it can be tricky sometimes, but I think we would truly know if they're having that, mood swing in their personality or anything like that. So thank you for equipping me and everyone else with, the signs we can look forward to if they are experiencing postpartum depression, so that we can get them the help that they need. We have not touched on creating a game plan. So what would be an actionable game plan that someone can use, or how do they create that game plan?
Yes, so there's lifestyle home remedies you can do and action plans you can create with your support system for when you get home after you've had your baby, where you're working on, okay, how am I gonna get my sleep? How are you gonna get your sleep? So that, if you need 4 to 5 hours of that uninterrupted sleep, okay, do I have my support from my partner to make that happen? And how's that gonna work? So really, really creating that beforehand.
Before baby comes.
Before the baby comes. Healthy choices. So making your healthy choices with foods, high protein foods, things that are going to make you feel good. Snacking, especially, if you're a nursing mom, you're a breastfeeding mom, you need to keep your calorie intake up, but you want it to be healthy choices. You want to feel good. Foods that are not good for you, fried foods, high in fat foods, they're going to make you feel sluggish. They're going to make you feel worse.
Yeah.
And having help with meals, shared responsibilities in the home, making a list of what can I forego during this time, right? What can I forego so I'm not so overwhelmed and stressed, and so my partner and my support are able to cater to me and the child, as opposed to, all the perfection sometimes people have to put into their home life. So consulting with other moms, joining support groups, online support groups. There's a lot of great online support that you can access, especially great when you're up with an infant in the middle of the night. And so you don't feel so alone and kind of secluded. There's peer support in your community. Look for the peer support program. So look to the people who have gone through similar experiences, who can share those experiences, and you can talk and, feel like you have someone to share what you're feeling with. Of course, counseling, talking to a specialist, and really honing into what mental health services are available to you.
I know that we talked about like having that partner and
Yes.
what a postpartum plan looks like with the partner. So let's say if you're a person who went on a journey where you don't have a partner to help you with those things, what would you suggest? And I know that I've heard something about having like a postpartum doula.
Yeah.
Would that be something that they can have or
Absolutely.
lead into their doctors? What can they do if you're at it by yourself?
Right. Absolutely. So doulas provide, doulas can work with you while you're pregnant. They can help you create a birth plan, go through the childbirth experience, and they also are very critical to that postpartum period. So helping you get through those postpartum days, and they can help you readjust and work on those postpartum plans and have that support and that emotional support they can provide to you. So doulas are really a great resource. And I would say to women who don't have access to that in-home support, I would tell them, contact your health plans, find out what services are available to you.
Yeah.
Ask about the doula services, try to get connected with one, see what's available at your provider offices, and really look in your communities of what's offered. Check out your health departments, your community-based organizations.
Yeah. I'm glad that you brought that up, especially about doulas may or may not be covered by your health insurance, because I think when people hear the term doula, they may think, first of all, what is that? And number two, it sounds too expensive. But if we don't ask questions, we'll never know the answers to those questions.
And doulas are non-medical providers, so they're not providing medical care, but they're providing support and education and helping coach you through the experience. And they're also, that support for you and can help work with you during such a critical time. And especially during postpartum, they can really be that support for you. Your health insurance may cover doulas. So I would direct women back to their health providers, back to their health plans to see what's covered. And then, again, look into the communities because there are a lot of community-based doulas as well.
That is true. And I think the moral of the story is have an action plan before baby comes and make sure that you're able to execute the action plan, but also know that things change. So if one thing's out of order, doesn't mean you have to stick to that action plan, but it's important to have a game plan in place so that you feel confident coming home and dealing with the postpartum of giving birth. And I know we've been talking about a lot of postpartum after the fact, having a game plan, but what are some of the resources? I know that you mentioned going back to your insurance plan or going back to your doctor, but what are some of the immediate resources that I can use? Because I know typically doctors are open Monday through Friday. And then if you call on the weekend, you got to wait for a doctor to call you back. But let's say if I'm going through anything at all, what are some of the additional resources that can be useful to somebody?
Yes. So obviously when you look back at your health plan, there's health plans, there's nurse lines. They're typically 24 hours. 7 days a week, nurse lines that you can contact. There's also the National Maternal Mental Health Hotline, and it's 1-833-TLC-MAMA, and we can make sure we get that number.
Yes, definitely.
So you can call that hotline anytime, and someone will be there to take your call, provide you with that support over the phone, help you figure out what you're feeling, and you can go from there with resources. There's the Suicide and Crisis Hotline, so 988, and that's the National Alliance on Mental Illness. So if you are experiencing, immediate crisis, you can call that hotline. On another scale, you can look to your online supports, your support groups through, social media.
Yeah.
There's lots of great resources and women and caregivers willing to come together through those support systems as well. There's peer-to-peer support programs in communities, of course, your mental health specialists, your counselors, and your regular providers, your OBGYN, your PCPs, your child's pediatrician.
So we have a lot of access and support and resources that are out there. We just have to make sure that we utilize them. Yeah. And I know we've covered a lot today, but there's one last question that I love asking, and I want to make sure that we cover it. If you could give one piece of advice to a viewer that's either listening in or viewing us on YouTube or anything like that can see us, what would it be?
I would say, yes, don't sit in silence, and that you deserve to feel good and to have a good experience and outcome. And so I would say, recognize what you're feeling, ask for help, share with someone you trust how you're feeling, and, reach out to someone so that you can start your journey to feeling better. And then you can have a better experience with your child.
Thank you so much for being here today. And the 3 things that you touched on in your one tip of advice, it would be to don't sit in silence. I think as women, we can do that, or people in general can sit in silence. So that is huge. Don't sit in silence, get help, and know the resources that are available to you. So Thank you so much.
Thank you.
Postpartum depression is the most common complication of pregnancy, yet so many women and families suffer in silence. Whether it's the baby blues, postpartum anxiety, or depression, perinatal mood, and anxiety disorders impact not just the mother, but the entire family. This conversation is just the beginning. Understanding the signs, risk factors, and available support is the key to ensuring no one has to navigate this journey alone. If you or someone you love is struggling, please reach out to help. There are resources available. From healthcare providers to local and national support groups, if you need immediate assistance, call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA or Suicide and Crisis Hotline 988. You are not alone, and there is help available. Remember to always consult with your healthcare provider before taking any action based on the information provided in this podcast. If this conversation was helpful, be sure to like this video, subscribe to our channel, and hit the notification bell so you never miss an episode. And if you know someone who could benefit from this information, share it with them. Stay connected with us on Instagram and Facebook at Sentara Health Plans, and visit SentaraHealthPlans.com to learn more about our health plans and wellness resources. Until next time, take care and stay well.